Hi, thank you for joining me for today's expert tip. My name is Judy McIntyre and I am an endodontist. Today's expert tip, I would like to focus on the importance of radiology. Insurance dictates that we take bite wings every 2 years and an FMX every 5 years. But as we know, patient decay, patient needs evolve usually much more rapid than that. So recently I was chatting with a very experienced and seasoned friend dentist of mine, and I asked her, before you place a crown, do you take a PA, a new PA? Her response was that she uses whatever recent PA is in the patient's chart. And that got me to thinking, what is a recent PA? Again, according to insurance, the FMX, that PA, that last PA, could be anywhere from a few months to 5 years prior. So you're basing current restorative plan, and quite an expensive commitment in the patient's time, as well as your schedule and patient resources, on something that might be several years old. So today I'd like to discuss a few cases on why I feel that this is so important, as well as take you through the script to how change the vocabulary and change the presentation of introducing the endodontist when needed, as it's related to these PAs. So in this first case, as you'll see, when a patient is referred to us endodontists, me specifically, I often get bite wings sent over. And I'm really confused. Why is a patient being referred based on bite wings? Maybe they have pain, but shouldn't the restorative dentist, shouldn't their dental home be taking a PA before they send over? It could be a crack. It could be a popcorn kernel. It could be unrestorable. So once again, the importance of x-rays seemingly is of utmost concern when there is any discomfort or where there is a referral outside of the dental home. In this specific case that I'm sharing with you, you can see that there is a large restoration on this premolar, very close to the pulp. Again, no recent PA. However, when we took the PA, you can clearly see that there's a periapical lucency, as well as the extent of it that becomes so clear on the 3D scan. This is something that gets very tricky to explain to patients, especially with new restorations. If this was there, if I'm in pain now, why didn't my dentist catch it before? And again, the solution is very simple. Take the PA before a new restoration or a new crown is treatment planned. It will save you a ton of headaches and build patient trust, especially when the referral to an endodontist will be needed either in the near or somewhat future. So speaking of, I'd like to change and discuss that introduction of the endodontist, because anytime the word root canal is mentioned to a patient, immediately feelings and emotions arise, and none of them usually are very positive. So usually what I like to recommend to my referring dentists is to show them our website, show them where they're going, show them that our office is nice and clean and cozy and inviting, show them that I don't have horns and fangs and ride a broom on the weekends, because your endodontist shouldn't be a scary place. It should be a place that's praised, because we are saving the patient's tooth together. Me, the patient, and the referring restorative dentist. So we really need that teamwork and that support, especially in the introduction. So my closing expert tip, in addition to taking x-rays before any new restorations or crowns are placed, would be to introduce the endodontist. I hope you've enjoyed the case today and these expert tips. Until next time, thank you so much.